This video is for informational purposes only and does not constitute legal, financial, health, or medical advice. How does Medicaid work in New York? Thanks for clicking our video. Don't miss out on any of our tips and news. Subscribe now and keep up with all our latest videos. Medicaid benefits more than 90 million low-income people in the U.S. It is a federal program administered by each state. Today, we will focus on the New York Medicaid program. Medicaid in New York 101. In New York, over 7.3 million people were enrolled in the Medicaid program as of December 2021. It pays for various services depending on several factors, including age and financial situation. The following are eligible for enrollment: pregnant women, individuals responsible for a child 18 years old or younger, blind persons, persons with disabilities, persons living with family members with disability, adults at least 65 years old. New York Medicaid covers doctors and hospital payments as well as nursing home and home care stays for eligible beneficiaries. But before anything else, it is essential to check with healthcare providers if they honor Medicaid, as it is not a requirement for them. Your choice of physician and the facility must accept government insurance, or you will have to pay for the whole checkup or procedure. Entities that accept Medicaid are very stringent with requirements because of Medicaid audits. Who is eligible for Medicaid in New York? To apply for Medicaid, you must be an American citizen with a residential address in New York. Beneficiaries are low-income citizens, seniors, and persons with disabilities. The following are some of the requirements that you need to present to establish eligibility for the program. Personal identification. You can present these proofs of identification when applying for the program: birth certificate, baptismal certificate, hospital certificate of birth, passport, immigration papers, current driver's license, Medicare card, income statements. The goal of Medicaid is to provide insurance coverage for those who don't have the means to pay for medical services to get the care they need. So, the state needs proof that they truly need this type of assistance. The applicant's monthly income for the last 3 months will be scrutinized to determine if it is within the Medicaid income standard. What is considered a low income? An individual with a maximum annual earnings of $19,392 before taxes. A 5-person household should have a maximum yearly income of $46,737 to be eligible for the program. Medicaid and healthcare providers need proper documentation to prevent errors in the course of the service. Asset and resource statements. Income may not tell the whole story. The Medicaid program will also ask for asset and resource statements for the last 3 years to analyze each applicant's financial capabilities. These are the documents you can submit with your application: savings bank books, checking statements, stock and bond certificates, life insurance policies, burial fund, plot or funeral agreement deed to a real property. How to apply for Medicaid in New York State? Every state has different application processes to provide insurance under Medicaid. One also needs to understand that the program periodically removes or changes beneficiaries to optimize the funds meant to benefit low-income individuals. There are various ways to apply for Medicaid. Call the New York Medicaid office or write them a formal request for application. You may also visit your local social services department, and their office will guide you through the application process. However, the best way to apply for Medicaid in New York State is to submit the application online on the New York State of Health website. Once approved, you will get a permanent Medicaid identification card. It should be presented when you get a medical service shouldered by the government insurance program. Special programs in New York for Medicaid. New York offers various plans that are exclusive to the state. For example, NY Medicaid managed care plans allow beneficiaries to choose a regular physician who will coordinate their health care plan. They will refer the patient to specialists and other doctors when needed. Most Medicaid programs also offer New York Medicaid transportation, usually in the form of non-emergency medical transportation, NEMT. Many beneficiaries fail to appear for their medical checkup or procedures because of the lack of appropriate transport, especially those that cater to those with special physical needs. Lastly, the program can help with Medicaid planning in New York or estate planning for older people or people with disabilities. Given these special programs and complex operations, all providers of Medicaid services will benefit from using Medicaid billing software. Such an advantage will also help their clientele and Medicaid beneficiaries. Medicaid is an excellent program for low-income people and the vulnerable citizens of New York. There may be some cons of Medicaid, but for the most part, millions of people have been able to get medical care because of it. Services are further improved when providers use medical software like BillPro to prevent mistakes in documentation and billing. If you enjoyed this video, give it a like and subscribe to our channel so we can share more content with you.